Good morning, lunchtime, morning still, we've got 3 minutes of the morning, so just going live over on Facebook and we will see, let's check in over on Instagram, checking connection. Let me know whether to say good morning, good afternoon or happy lunchtime. Maybe it's happy lunchtime. Welcome to this week's Biomechanics Q&A live on Zoom, Facebook and Instagram, so that wherever you are, we bring this platform to you, or this opportunity across the platform of your choice. So, sun is shining. I think we're all getting a little bit excited about some degree of a sense of normality up ahead. Which is wonderful, but it brings about questions around how we're going to help clients when it comes to getting them back to moving well, moving more, and moving more freely. So my special interest is in understanding the human body, making it nice and simple in application, and then helping practitioners, personal trainers, manual therapists in understanding simple application of biomechanical models. So the subject and the science of biomechanics, hey Helen, hey Max, how you doing? Can seem like a really complex subject. It can be really complex. But what I want to do in these sessions is try and bring to you little nuggets that we often end up teaching and talking about in our academy, in our Biomechanics Coach Diploma and our one-day workshops, to help learners, practitioners appreciate how it can be really simple. So the process of today's topic is about movement analysis, which of course can be very complex. We think about biomechanics as using video equipment, mathematical equations, measuring angles and force output and vectors and levers, and there's first, second, third class levers. So it is and can be extremely complex. And it's fascinating. So if you ever, or if you have already studied sports science at university, then that's usually the bit where everyone gets a little bit, a feeling of overwhelm, because it is trying to understand how we understand a diverse variation of physical presentations when we're trying to relay those and combine them with benchmarks or assessments or types of squat. And I think that's really where we're trying to bring that biomechanical analysis down to a nice, simple level of understanding. Welcome, Marina. I'm just going to bring myself up. So first of all, why would we want to analyse movement in a client? So this week, I'm going to try and get you super interactive. So Zoom, obviously you can interact. Facebook, I am following you guys. There's somebody watching over on Facebook. Instagram, it's a little harder for me because you're on a little screen, but do feel free. Chloe, Guru Fit, He-Man, great, got He-Man here, Tango Flow, you can, of course, I'll try and come to you as well. So you tell me, why would we want to analyse the movement of our clients? What would be the purpose of analysing the way a client moves? There's two kind of key, hi Mel, nice to have you along over on Facebook. So what would be two key factors in assessing a client? Any ideas? Anybody want to post something? Max, to be able to design a specific exercises for their needs and abilities. Perfect. Max, you've nailed it on the head. It allows us to bespoke their program. Perfect. Anything else? How else could we define why we might want to analyse movement and then make the program bespoke to the client? What might those assessments and evaluations tell us? Any ideas, any thoughts? Jim Jam or Carmel. Hey Carmel, how you doing? So fundamentally, as Mags has suggested over on Instagram, we need to analyse movement to bespoke our clients, either movement or therapy plan or whatever it is your background. And the two key factors that play into that are really about reducing risk and optimizing performance. So Helen, assess if the client needs any regressions. Perfect. First to build up, i.e. box goblet squat before moving on to the barbell. Yeah, perfect example there. Helen has described regression, which is a model for reducing risk. Because if you whack a client straight under a bar, it may be they're not ready for that. They need some tissue tolerance and some load. So perfect. It also allows us to optimize their performance of the squat. So you start with a basic body weight, maybe not so deep. You gradually add depth to it, as Helen's suggesting, and then you can start adding load. So this is all common sense. But how do we analyze their movement? This is the kind of area that I want to really bring back to. So we want to analyze their squat ability, don't we, to know whether we need to regress or progress. You know, if they're pumping up and down, they're like, well, this is really easy. Or if they're kind of struggling, we might want to analyze the squat. But there's a problem with a lot of movement analysis. And a lot of movement analysis is based on multiple joint action. So a squat, as Helen suggested, is a great example. Now, it is a good way of analysing what is wrong. The problem with it is it doesn't tell us why. So, for example, you analyse a client doing a squat and their spine bends over and their knees cave in. They're kind of, you know, then a couple of common things we might see. So we might then assume that the spine needs to be more mobile or have extension. And we might also assume that the abductors are weak. And that's what I want to highlight in today's session, because that might be incorrect. And it may be that we try the spine extension work and we work the abductors and it doesn't work. And so what I want to try and explain and get across in this week's session is there is a place, obviously, for multi-joint analysis. But if we can break movement down, understand the role of different parts of the body in those movements, we can start to see where there may be the problem actually has roots, if you like. So if we can break movement down into a very isolated fashion and understand, can they do that very basic single joint action? If they can't, then we want to understand, well, what's the prime mover? What's the antagonist, maybe? What's the fixator? And what are the synergists? And again, some of this language may be slightly different on different courses you go on. So I'm going to define each of those first. And I know a couple of them, most people are usually pretty okay with. So if we think about what's happening inside our clients' bodies, there's obviously a multitude of muscles, joints, and nerves. Same in the dog. Dog's just come in and joined us. So when they're doing that squat, how many of those substructures in how many different parts of the body are the ones that might be contributing to our client's knees buckling in and the spine flexing, for example. So we might want to break movements down. Now I'm going to use different examples. We're going to analyse some movements, single joint actions, and what I'd like you to do without any pressure, Omar, and Marina, and Mel actually. So I'm going to ask you questions as we go through. I'm going to show you a movement. Now, any biomechanics coaches watching this, or our movement instructors, you will have heard this before. So hang back a little. Let's get the others involved. See if you can hang fire, or if you want to have a go, obviously have a go. And what we'll do is we'll start to break movement down, analyse it in a really simple way. And there is just one rule. There is one rule. You're not allowed to use any individual muscle names. So to simplify the analysis of movement, we're going to go back to level 2 anatomy. And if you bear with me, hopefully this will make sense as we run through it. So if I was to ask a client, for example, to take the arm out to the side, so can you tell me, and I don't mean to patronise, but just to get the flow of the way I'm going to ask you the questions, what joint is moving when I lift the arm out to the side? So what is the joint that's moving, and what action is that? No muscles, just the joint action. So can you tell me what that joint action is? What is the joint and what is the action? Hi Maria, hi Raymond. Crab seal. I love all the names. Brilliant, good to have you all in over there. So anybody want to have a go? Shoulder, brilliant Raymond. What action is the shoulder going into? What would be the prime movement of the shoulder? Shoulder abduction, fantastic Max. Right, okay, so bear with me. If I said to you, if it's shoulder abduction, what would be the group of muscles, no individual muscle names, that are performing shoulder abduction? And it kind of gives you the answer in the question. It would be the shoulder abductors. Yeah, perfect. You got it, Hayley. Perfect. So, single joint action, shoulder abduction. We're going into shoulder abduction. So the prime movers are the shoulder abductors. Yeah. So the antagonist group, what would they be? I'm hoping that this is kind of slightly easy to begin with. Shoulder adductors. Yes, Mags, good. So no muscle names, Raymond. I'm trying to keep this really simple. Yes, it is the delts, you're absolutely right. But I'm trying to condition you into a way of thinking about movement in simple terms. And I'll explain why we're not using the muscles later on. You'll see why. Okay, so for me to be able to lift my arm out to the side and do shoulder abduction, yeah, let's say I've got a little dumbbell in my hand. A massive dumbbell in my hand. With these delts, it's probably small, it's probably right. So, action is shoulder abduction, prime movers are the shoulder abductors, the antagonists are the shoulder adductors. Okay, so what would be the fixators in that movement? So thinking about the name fixator, what kind of muscle contraction would you think a fixator group of muscles would be performing in that movement? And where might they be in the body? So no muscle names, just where would the fixators be? So if you imagine my central line of gravity, the arm comes out to the side with a weight in it, the centre of gravity is going to shift that way. What might happen if my fixators weren't fixing? What would happen? Yes, Charlotte, you got it. Good. Yes, Mel. Sorry, I missed that. Got you there. Any ideas? Any thoughts? What might be fixing? I've got to stop doing all the hand signals. I move far too much. Don't move, Rach. What would be a fixator area of the body so that I can do that? The trunk, the core, absolutely. Good. So the trunk muscles are going to keep me upright as the arm comes out to the side. So the central line of gravity doesn't pull me over to the side. So what that's telling us is that one side of the body is actually also working harder than another side. So which side of the body is having to work harder if this arm is coming to the side, which side of the body is going to be working harder? Yeah, and the hips, Mel, yeah, 100%. Lateral, Charlotte, yes, good. The scapula on that side, is it moving? Think about the scapula on this side. Is that scapula going to be moving? So a fixator is isometric. So that means it's not moving, it's just holding you in place. Yeah, just to be clear, I think it's Patricia. Is it Pat? Coward? Yes, exactly. So yeah, and the opposite side, Omar, perfect. So the arm comes out to the side, the trunk, core, hips are all fixators because they're stopping me from tipping over as the centre of gravity is pulled that way by the weight at the end of the arm. It's a long lever. Make sense? Good. So we've got one more, thanks Charlotte, you've got it. We've got one more area of analysis. Now we call these dynamic stabilizers. I have heard them called a variety of names. The reason we call them dynamic stabilizers is it kind of tells you what they're doing. So let me pull back again. It's a single joint action. It's the shoulder abducting, antagonist move adduction. Fixators will be the trunk, the core, the hips, legs. As the center of gravity pulls me this way, this side of the trunk core is going to have to work harder to hold me upright. This side will be working as well isometrically, because you can't switch one side on or off isometrically. I don't think. Mel, ever seen any research about that? I don't think so. So the whole trunk with this side predominantly. The dynamic stabilizers, again, by virtue of their name, must be moving. So where would they be in the body if there's a single joint action going on up here? Where will the dynamic stabilizers be? They can only be in one joint, can't they? So where would they be? This is where I come back to PH Coward. And you put a scapular question mark. So then the scapula on this side, as you bring the arm out, the scapula is going to rotate around the ribs. So the muscles around the scapula, whatever muscles are in there that are not abductors and adductors, are going to be dynamically stabilizing the shoulder blade so that I can take the arm out to the side and challenge the trunk on the opposite side. So any of the muscles that cross that joint that aren't prime movers or antagonists would be dynamic stabilizers. Does that make sense? Gets a little dance going on with it. Hi Lily, how you doing, Muscan? Okay, so, yeah, exactly, Charlotte, and the rotator cuff. Yep, perfect. So what we've got now is a very simple way of breaking movement down into a single joint move action. We know how to look at what's the prime mover, we know the antagonist, that's kind of the easy bit. I think the language of fixators and dynamic stabilizers is usually the bit where people get a little bit confused. You're very welcome, Max. So when you think about fixing something, it's going to be isometric. And when it's a dynamic stabilizer, and by the way, if you can let me know if there's any other vocabulary you were given or taught other than fixators and dynamic stabilizers. I think in my training, we had agonists, antagonists, and then everything else was a synergist that was involved in the movement. It didn't get broken down into fixators and dynamic stabilizers. Whereas, if we have the ability to understand movement, whatever language you want to use, it doesn't really matter. As long as you understand the movement, then what we can do is, when something's not happening, and a really simple example would be if they take the arm out and they can't do it without this happening, we might then think, well, is that the deltoids? Shoulder abductors, sorry. Is that the shoulder abductors, or is it the trunk muscles on the opposite side? Maybe. I mean, that's just based on the analysis we've just done. So where we've got the squat as an example of an argument for a good active daily lifestyle movement to evaluate, brilliant. It doesn't tell us what within that squat, because there's so many joints, muscles, tissues and everything involved in it, doesn't tell us exactly which part of that intrinsic system is contributing to the poor squat aesthetics, if you like. And there's also, we've talked in past biomechanics Q&As about design, so there could be some genetic things going on there. And I know that Stuart McGill does some great little videos on how to better understand, use it just literally having your client supine, lying down on a bed or the floor, and then you just literally take the lower shin, the calves, and you just gently flex the hip, and you see what happens when you add an abduct, and you kind of get into the point of bind. So there are lots of ways we can assess our clients. It's understanding what it's actually telling us. So Stuart McGill's example would be like a bony feel, and that can take practice to understand what's okay, how it's going to influence our squat, for example. There are more objective analyses where you can look at, you can test for anteversion and retroversion, which is a genetic design where the femur is genetically rotated in, i.e. you can't change it, or a retroversion, which is genetically rotated out, vocabulary again. And then the coxa valga, coxa vera, which is where you have a genetically wider or shallower angle between the neck of the femur and the femur shaft. So I've talked about those previously. These are all going to impact as well. So the more we can break movement down into isolated areas of the body to move, to assess, we could learn about nerve tension. I've done videos in the past about testing the median nerve, specifically in the arm. And it is really about isolating that area to identify in someone's body, in a client's body, which parts don't move as well as maybe they should. Or just seeing how they move and measuring it and using that as a benchmark, which is another method. So you can go on training and learn very objective measures. You can go on to therapy courses. Obviously that's what we teach. Or you can literally take basic movements that you understand that you might want to get a client to do and just ask them to do it. See what happens when you add load. Do they struggle? Are they ready for that move? As Helen was saying about do we load the squat or not? So I hope that makes sense, because there's a huge there's been a huge shift in the industry towards gross movement analysis and functional patterns and postural assessment. And when you're looking at more than a single joint action going on, the body's really, really good at compensating. And that gives us a problem, because it could be argued that abnormal functional movement patterns are just a visible demonstration of the body's amazing ability to compensate for intrinsic biomechanical flaws. So it's how do we differentiate between something we need to address, something genetic, and something where they've been locked down for a year and they haven't used the hip muscles in the same way. So a question might be, primarily, should we focus on movement patterns and try and prepare clients for active daily living using multi-joint actions? Or should we maybe break movement down a little bit and work out which parts of the body don't move as well when it comes to them performing that gross movement? So a bit of both. I'm not saying you must do one and not the other. I think they go really well together. But if we rely on a squat, for example, Helen might do a fabulous squat. And Helen, you move beautifully, by the way. She might do a fantastic squat, but actually, when we break the movements down of a squat and we just analyse, for example, her hip flexion, we might find that one side moves better than the other. And actually what's happening when she squats, the body's doing a really good job of making it look fantastic, but for some reason it makes her back sore. So the squat itself doesn't give us all the information. The other issue, just to flip that all on its head, is somebody might do a squat that looks asymmetrical. So I'm a good example of this, whereby my right foot, this is my right foot, I don't know if it's my right as I look at you, but anyway, this foot, when I squat, turns out a little bit more than my left foot. Now, I've been squatting for about 30 years now, so I know a little bit about what feels right or wrong. If I try and straighten that foot up to look aesthetically great, then it hurts at my hip. And I believe, I don't know, but I believe I have structural changes in the hip, having now formed a bunion on my right toe, possibly from running for years on a functional leg length discrepancy. So now, at the age of 52, I am left with structural asymmetries that mean actually squatting with a bit of asymmetry is much safer for my intrinsic biomechanics. So this is really just trying to help you think a bit broader about the way you evaluate a client's movement. Now, Helen and I teach Group X, and that can be a challenge when you've got, well, we're not allowed 30 odd people, are we now? We're only well, we are outside. I think we are outside. But indoors, it may be only 14, so maybe slightly easier job there, Helen. But if you've got 14 people in front of you all performing a squat, they have different limb lengths, different dysfunctions, different genetic geometry, different techniques, different history of injury. And then we've got this challenge of how do I make this as safe as possible? So this is why some group programs are designed in the way they are. They limit range to protect all the users. So yeah, you're welcome, Helen. And one side moves better than the other. Yeah, exactly. So yeah, one day back to Group X indoors with 35 people at a local club. That would be wonderful. So let me just pull back and let's come back to the original question. Why analyse movement? So we analyse movement to understand, as Mike said earlier, how to design a program for a client. And then Helen gave the example of we might regress a squat for a new client or someone coming back after a long break for a year. It's a long break, isn't it? So before getting under a bar, an Olympic bar might be 15 or 20 kilos, we may just get them doing a bodyweight squat or a little kettlebell, 5 or 6, 8 kilos, something like that, just to see how well they move and in a safer environment, so a kind of regression. And they are good benchmarks. So they may indicate to us, actually, let's just pull you back a bit. Let's test your pelvis specifically or your spine specifically, and we break the movements down. And if you go over to YouTube, I've done a whole bunch of these Q&As that are live on the Biomechanics Education YouTube channel. They're not live, they are recorded on demand. I've got to get my vocabulary right. But they're all there now. And we've done some of these tests in there, so you have to backtrack. I do need to update all the titles so you know which one it is. But so if we can break down the movement so that then we get them, okay, let's do a little bit of muscle release on the hips. Let's get some muscle energy techniques going on the hips so that then when they squat, and all of a sudden their squat improves. Fantastic. We know that we've prepared them for the squat better. We might even do that even if they do a great squat, just in case, just to check. So it might be that their body is cheating and making their squat look really good, but actually they still have, as Helen's saying, she feels different from one side to the other. Most clients usually, they'll tell you, won't they? So, yeah, this hip, this spine, this shoulder, there's kind of these, usually if it's biomechanical, usually in a zigzag through the body. So if it's the right hip, could be the left spine, the right shoulder, or could be any combination of those. So would you like to do another movement analysis task? Yes or no? Type your answer. Would you like to do another one? Hi Virka, welcome. Peace Fit, welcome. Abu, hey Amy, how you doing? Lorna, how you doing? Good to have you all in. Hi Daddy. So, would you like to do another one? You want to do another one? Let me just check in over on Facebook. You can say no if you've had enough and you want to have your lunch. Yes, please. Okay. Okay, even if it's just for the one. So, okay, let's pick a move. What move shall we do? Let's keep it simple. Let's do a 2-joint action. So again, biomechanics coaches, you'll know this. I'm your free instructors, you may remember it. All right, Charlotte, go on then. So let's do another movement analysis. So we're going to do the same process that we did earlier. I'm going to ask you no single individual muscle names, all right? I'm going to ask you one question at a time, so if you just answer a single response at a time, and we'll go through it, we'll break it down, and then everybody who's just joined, hi there Rich, Lee, how you doing? Good to have you in. So, if I was to say to you, and I'm going to define the movement so you can analyse it, I'm going to stand on one leg, I'm going to stand on this leg, I'm going to lift this foot off the floor. So this one isn't moving, this one is just hanging in the sockets. I don't know if you can see that. I know Instagram you can, hopefully Facebook and Zoom you can. Right, okay. So the movement I'm going to ask you to analyse is this. So literally this. So I'm doing a hip hitch. So before you start thinking about muscles, don't think about muscles. I would like you to just simply respond with the joint actions. So it goes like this. Standing leg, hanging leg. If you were talking about the hips and then the spine, you're going to talk about same side, opposite side as the standing leg, just to be clear. So, can you give me, yes, Marina, gold star over there. Okay, which side, Charlotte? Hi Jenny, how you doing? So let me show you again. So I'm standing on this leg, okay? This leg just hanging in the socket, and I'm just going to lift this hip. It's a pure frontal plane. So frontal plane is this way, yeah, sagittal plane, frontal plane, transverse. So frontal plane. So it's pure front. I'm trying to do pure frontal plane anyway, and I'm just going to lift that hip and down. So can you tell me the joint actions? Krista, standing leg, hip extension. Okay. Let me show you from the side. I'm going to go this way, see if it's easier. So, let me try that way as well. I feel like I should have put more fitted lycra on. Hanging leg, knee flexion. So forget the hanging leg, because it's not involved. I said this is just hanging there, it's not doing anything. So the joint action, so where is the movement happening? Where can you actually see the movement happening? Standing hip, hanging hip, shoulders, where can you actually see movement? So this is the start position, finish position, and then again. So there's the movement. So where is the movement occurring? So this side, I'm not going forwards or backwards, it's just hanging in the air. Any thoughts? Any thoughts, guys? I am Marina, doing my dance moves. So, let me bring your attention in. So, what we're seeing here is, let's have a look, we got an answer, Krista. So, my figure is that in order to keep up straight, slight hip flexion needs to occur in order to engage the core stability muscle. Strip it back, Krista. Keep it really simple. You're right. However, let's keep it. Yes, Charlotte. Let's keep it super simple, Krista. So, okay, let me run through it, Krista, and then hopefully this will help. Max, I think the movement is on the side of the trunk. Good. Rich Cadden's SI joint. Yeah, probably which side? So, okay, let's pull back. So everybody's thinking anatomically. Forget the anatomy, just the movement. So if you imagine the skeleton, so everything you're saying, SIJ, yes, I would agree, but what's the action? Yes, Joanne, let me help you out, Krista. Let me just show you, see if this helps. Right, I want you to imagine my skeleton inside me, and so if I was to stand on my left leg and lift this hip up, there are two joint actions, yeah? Two joint actions, one in the hip and one in the spine. So the question is, what is the joint action in the hip? Now I gave you a big clue by saying that this hip is not doing anything, this leg's just hanging in space. So there's no action on this hip. Yeah, bear with me. However, this hip is holding me up so that when I lift this side, what's happening is standing leg, hip, abduction. Can you see that? So if you imagine the line of the pelvis and the line of the femur, instead of doing that, I'm taking the pelvis away from the femur. Can you see that? So standing leg, hip, abduction. So then you're probably thinking, well, the other hip's moving. So what action is resulting in this hip lifting? What would lift the hip up? It would be the spine lateral flexors. So we have standing leg hip abduction and spine lateral flexion. And that is the two joint actions. Yes, Charlotte, you got it. Abduction of what? So we've always got to, whenever you're giving an answer, try and think about the clarity of the response. So abduction of the standing leg, hip abduction, lateral flexion of the opposite side. So if we become really clear in our understanding and then communication, and we practice that, we start to elevate ourselves up when we start communicating with clinicians, and I know we do get some clinicians in here as well, but we don't actually use this vocabulary. Exactly, Mel, this is why I wanted to do this, because we don't speak that way. Now, we've all got really frustrated about Boris not letting us help. We felt we were a frontline group, but we don't communicate like one. We're not professionalized in the same way. So we need to start behaving, speaking, and understanding and communicating in the same way. So if we can understand basic fundamentals, this is level 2, guys. Yeah? So understanding how to look at a movement, simplify it down to pure joint actions. So hip abduction looks like this, or it also looks like this. Yeah? This hip is lifting because the spine is laterally flexing. Make sense? The reason I wanted to pick this move, and we haven't finished yet, by the way, guys. I know we've got fixators and dynamic stabilizers to do. So, is because it's a fundamental movement. Every time you take a step, your hip will hitch up, hopefully. This hip will stabilize and abduct so that you can then, the foot clears the floor. And obviously it's not as obvious as that unless you're a catwalk model, which I'm obviously not. And so understanding how to break movement down, and when you're looking at somebody moving and you see that something's not happening or is happening, this then helps us program for them, as Mags was saying earlier. So 2 more questions. No, 3 more questions. So we've got the prime actions are hip abduction, spine lateral flexion. So without naming any muscles, what groups of muscles will be the agonists at the hip? This isn't a trick question. It would be if the action is hip abduction, exactly, it's going to be the hip abductors are the prime movers on the standing leg. So what would be the prime movers of the spine lateral flexion action? Spine lateral flexors. So can you see how it can be quite easy if we just think about the action first? Understand the action first. Okay. Hip abduction, spine lateral flexion is the prime movement. So the antagonist movement is adductors. Yeah, and the opposite spine. This is where I get my dance moves going on. When I get my the adductors of the standing leg and the lateral flex on the opposite side. So you've got your prime movers and your antagonists. Good. Fixators. So remember, your fixators are not moving, but they are allowing us to perform the hip hitch. So where in the body do I have muscles that are isometric, not moving, not crossing a moving joint? Remember the first 2 joint actions. What would be fixator areas of the body? Just dead simple. What would be an area of the body? Yeah, you got it, Marina. What is fixing me? You like my dance, Mags? So I told you in the original setup, if you remember, what did I say? I said about Are the hips moving, Charlotte? Have a think. Because we're talking about the fixators at the moment. So what would be fixing me? You are, definitely, Marina. What is allowing me to hip hitch? And I told you in the original, forget the muscles, no muscles, Krista. So keep the muscles out of it, and remember, do those muscles cross the hip, because the hips are moving. So any muscle in the hip can't be a fixator, can it? And a fixator by definition is isometric. So the isometric bit of the body is down here, isn't it? It's from the knee down, is the fixator group. So by standing on one leg, hitching the hip, so abduction, lateral spine, lateral flexion, antagonist moves, the fixators are going to be those lower limb muscles and the foot, anything that's controlling at the foot. Fixators. So the dynamic stabilizers, Charlotte, Krista, without using individual muscle names, yes, Amy, you got it, nailed it. So where in the body are muscles moving? There's only two joint actions. Hips, spine. So if the frontal plane muscles are involved in the primary action and antagonist action, where are the dynamic stabilizers allowing the movement? They're still moving, so they're dynamic. So where might they be? They have to cross the moving joints. So it's going to be the muscles at the front and the back of the pelvis and the spine. Yeah, exactly, Krista. Which is why I wanted to do this. Yeah, exactly, you've got it, Charlotte. But that's why I wanted to do this, Krista. So the point of the process, I'm going to come to it at the very end, is if we break movement down really simply, it can be really easy, but it's using logic. One of the big issues that I find in the classroom all the time, I've been teaching 16 years about anatomy. I come from a non-academic background. I've learned tactics, and the tactics are to simplify it. Yeah. So the simplification process means that if we go back to our level 2 training, abduction, adduction, prime movers, fixators, flexion, extension, and then we look at moving and break it down. The problem is that's not what we're looking at. We're looking at someone walking across the room, or we're looking at them squatting, or we're looking at them doing certain things where there's a multitude of joints, muscles, nerves contributing to the quality of that movement. So if we can break movement down and just ask a client to stand on one leg, can you lift your hip? And they can't. If you can analyse what's going on and you've broken it down to pure hip abduction and lateral flexion, and there's some stabilisation at the foot, and you start to see the foot's hanging on, the foot's wobbling around, maybe there's some proprioception there, maybe it's a stability issue, it may be that the hip doesn't lift, maybe they do a weird hip flexion move because the QR muscle, the lateral flexors in here are stiff. You think, right, okay, so before I get you squatting, I'm going to get you to do some wall glides and release off that little muscle in the back. So when we break movement down into this simple process, what's the joint action? What's the prime mover? Forget the muscles, just talk about the prime movement is shoulder abduction or hip abduction, lateral flexion. Forget trying to work out the muscles. Let me give you an example. What in the quads, what would the quads be doing in a hip hitch? So if you know the quad muscles, and this is just to give you an example of why we forget the muscles. How many quads have you got? Hi Kartik, how you doing? How many quads have we got? Depending on the literature you read, I'm aware there are 5, maybe 6. Yes, exactly. But let's say there's 4 basic quadriceps. Rectus femoris, then the vastus group, vastus medialis, intermedius, and lateralis. Are they fixators, prime movers, dynamic stabilizers? What are they doing in a hip hitch? So a hip hitch here, so if you look at this leg, What are my quads doing? Are they fixing? Are they prime movers? What are they involved with? Yes, Charlotte, 4 normally. So what role do the quads play if we were to individualize them? Are they fixators, prime movers? What do you think? What is the role of the quadricep group? Sorry, what action? Oh, well, tell me what action do they perform? What do quads do? Krista, now you're nailing it. You bang on, exactly. You're in there. So when you know your anatomy, it's not so hard, but when you don't know your anatomy, it becomes complex. I'm going to give the answer that Krista's given. So the quads are knee extensors. Am I doing knee extension? No. So then are they fixators? Well, some are, but one isn't. So the vastus group do not cross the hip. So if my knee is static and they stop before they get to the hip, the 3 vastus are fixators. However, rectus femoris crosses both the knee and the hip. So if the hip is moving, then the rectus femoris is a dynamic stabilizer. Do I do a mic drop there? Well done, Krista, you nailed it, you got it, absolutely. A bit of everything. Yeah, probably, Charlotte. Does that make sense? So, Navitas, extension of the knee and stability in a hinge. Yes, you're absolutely right, they do. So, what's the joint action? Break it down. Now remember, what you're looking at more often than not in a client isn't a single joint action. If you want to really understand which parts of their body are maybe limiting their movement quality, break movements down a bit. Ask them to do just basic knee lifts. Does it look clunky on one side, but their squat looks amazing? That might be somebody like Helen who said she feels different. So it might come out when she does a knee lift, yeah, or a certain movement, a very isolated movement. If you want to take the stability problem out of it, you could lie them down and do what Stuart McGill teaches and just take the knees forward for her. So she's nice and passive, and we see whether it's actually a joint issue. So this is where doing CPD or little live biomechanics Q&As like this, we can start to understand actually just using a squat as an analysis doesn't tell me why, and also they could look amazing, but the body might be hiding something. Your body is a fantastic piece of architecture, and it will do everything it can to make you feel better and move in the way you want to, sometimes to its detriment, but to allow you to get the task done, or your client to get the task done. So I just wanted to take you through this. It's actually it's level 2, maybe crosses over level 3. This process of how can we understand movement simplistically, rather than getting too clouded up into the muscles, which, as Krista has suggested earlier, if you know them, great. But if you didn't know what they do, and the fact that 3 quads will do one thing, 1 quad will actually do something else as well, it becomes a little bit more challenging. We lose confidence in our ability to help and coach clients. And if you can just think about, well, as long as they're a stabilizer, then we're trying to understand what the role they play in movement. So breaking it down. So I hope that makes sense. So why analyze movement? To reduce risk and optimize performance, to know when to regress, to know when to progress. This is a perfect opportunity to gain skills in analysis of joints, how to understand your client's biomechanics. That is, of course, what our school specialises in. If you want to know more, there's loads. We teach 43 physical assessments. Until then, and hopefully I will see you at some point, I know I'm going to be seeing some of you soon, just practice analysing single joint actions. Think about, try and remove the muscles from the equation. See, watching people. Are you like me? Are you a bit of a weirdo? You know, you watch people's feet. See whether their feet turn out at the ankle, the knee, or the hip. Is that a combination? You're trying to work it out. It comes back to the so what question, doesn't it? Can we help our clients? Of course. Can we help them more? Yes, of course. Can we learn more skills? Yes, of course. Is now a great opportunity. Absolutely. They're coming back from lockdown, maybe in more pain, maybe with stiffer joints, tension in muscles. We need to get the nerves mobile as well. You're very welcome, Krista. Thanks for coming along. So I'm going to bring it to a close, aren't we, Skelly? We've got the doors wide open. I'm going to chill out and have my lunch. Guys, thank you so much for coming. Go over to Facebook, Biomechanics Q&A group. You can ask a question at any time. Maybe we'll discuss it next time. Keep going, guys. Take care. See you soon. See you, Facebook. See you, Marina.